Thank you, Mr. Speaker, and thank you, Chairman Johnson, for your leadership on this. I want to concur fully with the remarks that you've made. As you've indicated, in 2008, I filed this piece of legislation. With Chairman Johnson's help at that time, we worked together. We passed it through the House, and the Senate failed to act. And since that time, whether it was under a Republican or Democratic administration, there has not been sufficient priority placed on this by the Center for Medicare Services to address this question of privacy. It is a serious matter. It clearly requires legislation, and this time hopefully where the Senate will respond to our bipartisan initiative and get it passed into law. There are indeed about 48 million Americans, seniors, individuals with disabilities, who are carrying in their wallet or purse today something that makes them vulnerable to identity theft, and that something is their Medicare card. Apart from the Social Security card itself, the Medicare card is the most frequently issued government document that displays a Social Security number, and that practice invites foul play. It was back in 2007 when the Bush administration, recognizing this danger by the overuse of Social Security numbers, sent out a directive to federal agencies to eliminate the use of Social Security numbers and explore alternative identifiers. Despite this directive, Medicare has not yet taken appropriate steps to remove the numbers from Medicare cards. Although we have bipartisan agreement on the severity of the problem, we also have had bipartisan administrative inaction when it comes to addressing it. Clearly, we need congressional action. To protect both the savings and the peace of mind of Medicare beneficiaries, this bipartisan legislation would require Medicare to take steps that private companies, the Department of Defense, and the Department of Veterans Affairs have already taken to protect the identities of those that they serve. Every time that a senior or an individual with disabilities hands over their Medicare card to a health care provider or elsewhere, they are handing over the keys to their financial security. With increasing sophistication by identity thefts, inaction here again is simply unacceptable. Seniors who have saved, who have built a lifetime of financial security, and their reputations are all at stake. Their savings and their credit should not be put needlessly at risk if someone steals a Medicare card or gets misplaced or left with a provider by mistake. Medicare should make sure that it does no harm to the financial security and credit rating of those that it serves with health care security. This act will help to ensure that the government better protects our seniors, denying thieves access to this critical data. Inaction would jeopardize in a continuing way the safety of so many. This legislation, when we previously introduced it, was supported by Consumers Union, the National Committee to Preserve Social Security and Medicare, the Silver-Haired Legislature nationally and in Texas, as well as the Elder Justice Coalition. Seniors confront many threats to retirement security these days, but this bill will be directed toward one that we can do something about immediately, and that's those who would swindle our seniors. I urge adoption of the measure and reserve the balance of my time.